At the beginning, the women were doing to please the men. Nowadays, women are much more empowered by themselves. They don't need to please the men. They do because they want self-confidence for themselves.
Is there such a thing as a perfect face?
They did a very interesting study a few years ago. They took Angelina Jolie and Brad Pitt, which we all know they are the two most renowned, handsome people in the world, in the female group and the male group. They took their faces, a photo, they cut the photo in half, and they put one half on the other side, so make them symmetric. I saw those pictures. They're less attractive than they are now with their asymmetries. So I always tell my patients, symmetry is not beauty. Nature is not symmetric.
Today's guest on the show, one of the most well-known and well-trusted surgeons here in the UAE. His name is Dr. Matteo Vigo. He's been in now for an awful long time. He knows everything that there is to know about plastic surgery and has conducted over just breast augmentations, over 1,500 operations himself.
I had 14-year-old girl coming with the mother asking for the breast augmentation. And I said, no way. And this is all because of the social media.
Hi everyone, and welcome to this episode of the podcast. Right, if you haven't subscribed to us on YouTube yet, please do me a favor and subscribe. It would mean so much to me if you did. What's the benefit to you? I'm able to bring better and better guests for you, to bring value to you and hopefully educate, inspire and entertain you at the same time. Today's guest on the show, well, I wanted to talk about plastic surgery, but from a couple of different angles. Number one, how it's evolving, particularly here in the UAE. Number two, is body dysmorphia causing a rise in plastic surgery and the requirements and desires that people have? And number three, are men secretly getting plastic surgery done without us knowing? That and many other aspects to plastic surgery are going to be discovered with my guest, one of the most well-known and well-trusted surgeons here in the UAE. His name is Dr. Matteo Vigo. He's been in now for an awful long time. He knows everything that there is to know about plastic surgery and has conducted over just breast augmentations, over 1,500 operations himself. So let's dive into this episode, learn everything that we need to know about the ever-changing landscape of cosmetic surgery, the problems that it causes, the benefits it gives, and those sneaky men that are doing it in secret. And you wouldn't believe the requests he's got from patients today. It literally blew my mind. Please welcome Dr. Matteo Vigo. I don't even know how to start this conversation, if I'm honest with you. Dr. Matteo, thank you for coming to join us on the show today.
Thank you so much for the invitation.
Are you the man that's responsible for making everybody in Dubai, every woman in Dubai, look the same?
Not every woman, and if they look all the same, they're not my patients, definitely.
Let's I probably start off with some light talk around this subject, because I think it's for some people quite taboo, some people quite uncomfortable, not in a dangerous way, but just there's an element of embarrassment and stuff like that around some of the stuff that goes on in the world that you live in. So I'm a guy, and you are a doctor that specializes in breast augmentation.
Yeah.
And that seems to me, based upon me being 55 years old, I don't remember there being something before boob jobs that was plastic surgery.
I think the boob job was something that started the hype of plastic surgery. Was one of the first things. Actually, no. The first thing was liposuction. The real first thing was liposuction that started the hype.
So can you take me back? How long ago did liposuction start? When was the first procedure?
The first procedure was, I think, back in the 60s.
Never.
Yeah. Back in the 60s, where there was a huge competition by these two doctors. I'm sorry, I don't recall their names, but one was French and I met him. When I met him, now I think he passed, but it was such an interesting guy. And he said that he was the inventor of liposuction. It was this other guy from Brazil saying, I'm the inventor of liposuction. There was a big fight on that. But the French guy, I remember his story, how he invented the cannula to aspirate the fat. He had the girlfriend, the wife at the time, who has a lipoma on the back. And usually to remove a lipoma, you make a scar and you take out. It's a surgical procedure, so full surgery. And this woman said, I cannot have a scar on my back. I like to wear, dress that open on the back. I said, I cannot have a scar. So he said, okay, how can I find it, etc. I said, okay, I'll make aspiration. So he make a small incision in a hidden part, and with the suction machine, he took out the lipoma. And this is how he invented, okay, what can I do in other parts of the body? So liposuction was the first procedure that was really in the aesthetic, because plastic surgery as reconstructive goes back to the, 15th century. Tagliacozzi is an Italian surgeon who did the first reconstruction for the nose. There was a guy who had an accident, something, the nose fell off, and he connected the forearm of the guy to the nose for like a couple of months in order to let the skin regrow, and then it detached, and the guy was going like that.
Wow. Okay, so there's actually probably be a good lesson that we're going to learn here. So how long ago did breast augmentation start?
The first implant was in the late 60s.
And so when this kind of stuff started, and we'll talk about all of them, did they start because of a necessity to deal with something like an operation to the face where had gone wrong, or burns,
no, it was
cancer?
Mainly reconstruction.
So reconstruction surgery.
So, women with breast cancer that remove one breast and it was taken, amputated for the rest of their life. So they try to find a way to rebuild the breast, and they tried many different ways. And one that was the most suitable was put a breast implant. Of course, the implants used in the 60s were totally different from the one we have today, and a lot of complication, rupture, leakage, whatever. But it was the beginning of the evolution of the breast surgery and the breast implants, which nowadays are, tools that are super resistant. The women can take for the rest of their life. They don't have to. Also, the hype. You need to change the breast implant. You can keep them. If your result is still okay, you can keep them.
Okay,
so it's an evolution.
So the first was in the 60s, and when did, from a cosmetic point of view, when did a lot of this stuff become popular? Was it as far back as the 80s, or was it in the 90s that it started to become, or even later that it became like popular? I'm gonna go and get a X job, a nose job, a boob job, whatever it may be.
I think the first steps were in the late 80s. Okay. But the 90s were the booming, and especially the breast. We have to thank Pamela Anderson.
Okay.
Pamela Anderson was the first icon that obviously had her boobs done. Everybody knew that she had the implants, and everybody started looking at her and said, I want that. And we have to, in a certain way, thank her, because from her participation to Baywatch, where she was in the swimwear, so the boobs were in the face of people. Women start saying, I want this. Men were asking their partners, wives, etc., why don't do that? And this is how it started. Then in the 21st century, of course, 2000 and above, the popularity grew, and now you have lots of women with breast implants, really.
I'm going to talk about men in a minute, because I think there's a really important subject to cover there. But when we think about women having breast implants, and you said Pamela Anderson, so you made me think, how much of cosmetic surgery today is down to men's desire for the female form perfectly created in their own mind, and how much of it is women themselves being influenced, whether that be social media or movies or whatnot, by other women to want it? What have you learned about that?
It's a big shift. In my 20 years of career, I see a big shift in that. At the beginning, the women were doing to please the men, whether it was a request from the man itself, so go and do this procedure, or more like a subtle signals, okay? I'm going to pay for it. If you really want to do it, I'm going to pay for it. Something that encourages women to do. Nowadays, women are much more empowered by themselves. They don't need to please the man. They do because they want self-confidence for themselves. So I see women coming and do the procedure without the husband knowing. because they don't want the husband to know, for example, or the partner or the whatever, the boyfriend. And because they want to do for themselves. And also in my practice, I do a lot of subtle enhancement. So something that is visible, but not in the naked eye. So if you see someone yesterday and tomorrow, you maybe don't understand. You say, oh, you look fresher, but you don't understand what she did, okay? And that's what women want now. Something which is not visible. Because even if the stigma of having plastic surgery has gone, so it's not a taboo anymore. Everybody is very free to talk about plastic surgery. There is no, oh my God, you've done plastic surgery, don't talk about it. But still, at this point, people want to do something that people don't know. And that's the beauty of, the world, how the evolution of this world is coming. So the minimal invasive technologies, the products that are coming up in the market, everything that is for this goal. And I'm proud that in my practice, I always enhance the beauty of a person without transforming them. So my results are natural. And that's what people want at the moment. When they come in, they want this.
Yeah, I get that. I believe that there's not a plastic surgeon on the planet that's not going to say the same thing, though. So let's park that a little bit. To me, the measure of somebody that's a good cosmetic surgeon is somebody that as often says yes, says no. Because clearly there are people out there that I look at that want to get something done, and I'm looking at them going, I've got no idea what you're talking about. And so arguably they have an outside influence from some form of real person that exists. They have an influence from social media, or they've created some form of body dysmorphia where they truly believe that their X, Y, or Z is not big enough, small enough, the right shape, and all that kind of stuff. So be really honest and level with me here. Do you often have people coming to you, we'll just stay with women for now, so I'll go on to the men in a minute, women coming to you and you're sat there looking at them going, what are you talking about?
Absolutely.
And give me an example of something that you would go, no, love, that's not, sorry, I'm London. No, love. No, dear, that's not happening. I won't do that type of procedure because you don't need it. Give me an example of something like that.
Well, the most famous episode that comes to my mind, or famous is a patient of mine who came to me several times to do a little bit of touch-ups. It was not surgical, was aesthetic medicine, because I do also fillers, injectables, all this stuff. And every time I was doing a little bit. And she came one day and her lips were done by me already, and they were the maximum volume that I would allow to my patient to walk out of my office with. And she said, I want more. I said, I'm sorry, I'm not doing it. No, but please look at me. So she took her phone and she had a full gallery of thousands of pictures of her lips taken to selfies in all different angles, position, up, down, etc. So already this is a sign that there is a dysmorphia. There is something that's wrong with the patient. Had thousands of pictures of their lips, so not good. And I said, no, I'm not injecting more in your lips. It's enough. It was COVID time. So she came back to me after 1 week with a mask on, so COVID mask, and said, I know you're going to hate me, but I went to have my lips done, and now they look horrible. So she went to an unlicensed professional in Dubai. Oh, I don't know what she injected. The lips were completely distorted, but really distorted. So I, of course, helped her. She was a long patient of mine, and I dissolved all the fillers she had before. And the lips came back as they were before we started the treatment. 2-3 sessions of these dissolving injections, and then she came back and said, okay, doctor, now you have to inject more. I said, I'm not going to inject you. You have broken the circle of trust between me and you, not following my advice and going to somebody else, which also is unlicensed, to inject something and give this result, come back to me crying to solve your issue, which I did. Now I refuse to treat you. He said, I'm going to report you to the health authority because you're not treating me. I said, please be my guest, welcome. But this is a dysmorphia. and a very interesting discussion with a psychologist in my podcast about the Snapchat dysmorphia. There is a full term that has been,
Snapchat dysmorphia.
Yeah, it's full. Psychologists know about it.
Tell me.
It's about the fact that you see Snapchat is because one of the social media. Could be Instagram, could be TikTok, but they call it Snapchat dysmorphia because they see these faces, bodies transformed in a way, and people at a young age. I had 14 years old girl coming with the mother asking for the breast augmentation.
14?
Yes. And I said, no way, your breast is not developed. Why am I going? No, but she feels ashamed to go to work, to school. I said, you are 14, you're not developed. Maybe in 4 years you have a cup D because you don't know how the development, the maturity, the sexual maturity comes. I'm not gonna do that, and I have some regrets of that. So, and this is all because of the social media.
So social media is playing such a big role in the lives that people are then just comparing themselves all the time to something that they, an image they see that they say to themselves, that's the perfect look, that's the bum, the thighs, the lip, whatever it may be.
They create a lot of insecurity among the young generation, and to see the perfect girl in a bikini, I said, wow, I need to look like that. But they also, social media give all the shortcuts. You want to look, okay, go, healthy diet, gym, train yourself, whatever, and you can be like that. No, go to the plastic surgeon.
So it's back again to the same old thing. It's like shortcuts. Nobody wants to take the long road there. So you could get a great body if you stopped eating the shit and drinking the shit you're drinking, and had a healthy diet and worked out and did the right kind of exercises. You could create a really nice body for yourself.
Yeah.
But you don't want to go through that. So let's get some liposuction to get rid of that fat that I've created because I've been sat on my bum looking at Instagram for hours every day. I haven't been to the gym. So that's my shortcut there. And I suppose the question has to be now, because of how this has evolved, are men more and more looking at these types of plasticky bodies, these types of changed bodies now, and are they less attracted to them than they used to be? Or are they still, or does it still have the same amount of pulling power?
But we live in Dubai, and you see, if you go out in any restaurant, you see these women which are perfect. Okay, yeah. So super tall, slim body, maybe the breast is done, in very tight dresses, and of course a man will look to them. Okay, so women are forced in a sort of, and also the society is changing. 20 years ago, a woman in her 30s, most of the time were married with kids, mother, wife, etc. Now there are a lot of single women in that time frame.
And that, in that age group, yeah.
Exactly. And that is when they're looking for a man. And okay, you can put yourself with a big smile, nice empathy, nice attitude. But then what the man looks first is how you look. So why, all these influencers that sell makeup are billionaires? Because makeup make you beautiful. And it's why the hairdresser are charging crazy amount of money to have the perfect hair, perfect blow dry, because they make you beautiful. Stylists, all these kind of things is because everything is going in that direction. Okay, the perfection of the exterior body, and what is for me also being a father to scaring is what is scaring is the fact that the inside is going missing. So I enhance the body of women, of men, of my patients. So I work on that. But I always try to understand why they're coming to me. So not because you want this and you pay me, I do this procedure 100%. If you're not mentally stable, if you're not mentally ready, and you do to please your husband, I have a lot of couples coming in, and the husband said, oh, we want to have her boobs. I said, excuse me, she wants to have the boobs, not you. Why you talking about we? So can I talk to a patient? So when I see this kind of attitude influence, maybe a woman very shy and the husband talks on her behalf, that's not my patient. I'm not going to treat her because I'm going to please him and not her. And she's going through a surgery, which I can make it less painful as I can make the recovery super smooth, but it's still a surgery because of him. So when I see this disruptive attitude, I stop immediately.
Let's move on to men for a minute. It's almost like there's this chart and it crosses over. I don't know what the age is that it crosses over, but we get better, if you know what I mean, as we get older, or so they say. Okay, and women fear that women get worse as they get older. So that's probably, again, stereotypically designed, but probably why less men would be going down the cosmetic route, because they've been told you'll be a fine wine, you're aging nicely, you're beautiful, you know, grey hair looks good, wrinkles look good, makes you look rugged and all that kind of stuff. Yeah, wrinkles on a lady makes you look haggard, wrinkles on a man makes you look rugged. I've just said that out loud. I'm not really done. But clearly there are men now that are doing more of this kind of stuff than ever before. So what are the kind of like the opening questions you get in terms of what type of treatments men talk about or ask about, and does it generally end up being one thing, or do they get into it when they see a result and want to change more things?
It could be a spiral thing, even for men, because again, if you deliver them a good result, they look better, they feel more confident, and they start seeing little other defects. And I said, okay, why don't treat also that? And they can go in the circle. Women are more on that. So women are never happy. So they always find some defects and they want to fix. Men, usually they come, one question, I have my eyelids done, I want a liposuction, I want my nose done, whatever. I do this and then I'm done. But nowadays, there are a lot of more requests. And what I see, and this is very interesting, is a social perspective, I have a lot of wives coming to do their eyelid, their facelift. And after a few months, their husband comes in. Said, I seen my wife eyelid. I'm thinking that I need it. So the also comparison, and men are saying, why she's doing everything and I cannot do that. So the society is changing in this direction. So even men are less ashamed to talk about it. And they are very happy to, be also testimonial for, I ask sometimes a patient, do you want to share your story? Because people love to hear from the real patient, not only from me in my social media saying, oh, this is perfect for you. I want to see the real faces. And men are very much more relaxed in talking about that, okay? Because when they take the decision, it's a decision. They don't hide it. And if you see also celebrities, they do a lot of things. And there is a lot of talk about it. Now there is Brad Pitt seems to have had a facelift maybe or something like that. So there was some, rumors about that. There are a lot of comparison on the men, how they were before. Tom Cruise, for example, how he was when he was younger and how he is now. And you can see that he's aged, but in a gracefully way. That's also very important, how men don't want to transform themselves. They want to age gracefully. That's the other difference. Women, sometimes they want to transform themselves.
Okay, folks, let's talk about real estate. Now, a recent partnership that we've just established on the podcast is with AYS Developers. Luxury properties with high-end finishes from people that really understand the subject. Often in Dubai, you'll find stuff that is maybe substandard. With AYS Developers, you're not going to see that. You're going to see fantastic properties that you can buy, you can invest in, you can make your home on Dubai Islands and other places too. So go visit aysdevelopers.ae and check them out. I promise you it'll be worth the trip. When we look at men, there still must be... So I remember... So you know what Viagra is, obviously. When Viagra came out, there was a female and a male Viagra that came out and was tested many, many years ago. And I remember being at my mum's house. Now, this must be, I don't know, 25 years ago, maybe 20 years ago, I can't remember. And my mum and dad were testers for Viagra. And my mum will kill me for saying this on the podcast. she's going to listen to this.
You are an orphan now, you know that?
My mum listens to every single episode when she's at home, and so does my dad when he's in the garden. So anyway, to both of them, they were Viagra testers, and it was kind of such a taboo thing, like, what, you were going to take this tablet and this tablet was going to do what? And obviously he explained what the impact of it was and the effects of it was, and we laughed about it, and you know, even to this day I don't even want to think about what was going on. But that was very taboo. It feels like it's still a taboo type of thing. And do you believe that men are more interested in how they look than they are in how they perform? Are they more interested in how they perform?
That's a difference. So if you have an erectile dysfunction, you feel less a man. Yeah. Okay. So it not only undermine your confidence in the work environment, because in the work environment, nobody knows about it. Okay. It's in your bedroom that they know that you have this problem. So if you have a problem in your bedroom, you keep in your bedroom. So this is a private thing. It's different. The way you look is somebody looks at you every day. So if you change the way you look because you're not happy because you want to enhance yourself, whatever, it's less a taboo because you want to make an impact, okay? And you want to, in a certain way, shout it out loud. While if you have an erectile dysfunction, you don't want anybody to know it, right? So it's a very private thing. And again, now, for example, even for the breast, women don't want people to know that they had a breast augmentation. They want breast enhancement. We are shifting towards minimally invasive breast procedures to have this kind of subtle change. A woman said, I don't have to wear a push-up bra and a padded bra anymore. Because they do. So without the bra, the breast looks like it was in a bra. That's the goal. And people will not know.
Let's give people some understanding of some credentials here. How many breast augmentation surgeries have you done?
I think I'm more than 1,500.
More than 1,500 operations?
Only for breast augmentation.
For breast, okay. And 1,500, how many of them have gone wrong? Be honest.
Wrong, maybe...
Where the patients complain?
10.
10.
Say. Yeah.
And what, so out of 1,500, 10, okay, thank you for your honesty, I really appreciate that. Where they went wrong, what kind of things went wrong?
We had some early complication, like bleeding, that can happen, so I had to reopen the patient. Actually, this happened only one time. We had some infection that maybe was problem of the patient, not hygiene at home or not taking care of the scar the way they need to. Sometimes the implant didn't sit in the right position, so there was an asymmetry. They had a capsular contractor. There are many things that can go wrong in a surgery like that because it's not only the hand of the surgeon, it's also based on the implant that you're using. So there's a device, and there is the patient attitude after the procedure. So how they take care. Follow my instruction, don't do gym, don't do this, don't swim. Yeah. So there are a lot of things. But yeah, breast augmentation is quite a simple procedure. So it's quite straightforward. And I'm trying to do always in the less painful way, so recovery is fast, etc. But there are other procedures that are, of course, more risky.
1,500 surgeries. How much do you charge for breast augmentation surgery? What is it, roughly? I want to work out.
Now I charge more. At the beginning, I didn't charge because, of course, I was less experienced. So I was charging very less. But now I charge more, yes. Definitely.
I've always wanted to know, how does a plastic surgeon become a plastic surgeon? So do you do standard medicine for 6 years?
6 years. In Italy, it's 6 years medicine. And then you decide, different countries are different regulation. In Italy, you go straight to your specialty, which is plastic surgery. During 5 years of residency, you rotate also in general surgery, in ophthalmology, in emergency. So you do a rotation in hand surgery, orthopedic. So you see different kind of, but the main thing is the plastic surgery.
So that's 11 years.
Yeah.
11 years. Wow. I asked my neurosurgeon, why did you become a neurosurgeon? He said, well, I studied medicine for 6 years, then I had to choose my speciality. And I was reading a book about a neurosurgeon that was a multimillionaire. And I thought, that'll do for me. And I'm like, come on, there must have been something more to it. He said, it's not. He said, it's sometimes really hard when you've got into medicine, you don't know what you want to do. You think you know, and then someone takes you off track because you hear a story or you get a bit of experience where someone's doing that. They're 1 or 2 years ahead of you and they're like, oh, this is the worst thing in the world.
Yeah. No, for me, the money was not the initial drive, definitely. I wanted to become an anesthesiologist. Because when I was 16, I was working as a volunteer on the ambulances in my little town near Milan. And I love the emergency situation. And in Italy, when you do this as a job, you are an anesthesiologist. So I wanted to become that. And then in my first year of medicine, I went to Ireland because my sister was living there at the time. And I did the training with anesthesiologists in the hospital. And I see the life of anesthesiologists in the theater. And for me, it was boring. Because when you do the theater part side, is more put the patient to sleep, check the vital signs, etc. But there is no action for you unless there is a complication. Otherwise, most of the surgeries are quite calm. And I said, I don't want to do that. So I shifted and I said, but I cannot do something like cardiology, gastroenterology, because for me, again, it's boring. I'm a very practical person. So I said, I want to do surgery. And I went to the general surgery. And the drive that brought me to plastic surgery, because general surgery, you work in a hospital and you're always, until you are maybe my age now, 46, 50, under the umbrella of somebody else. You have the big boss, which is a great surgeon, whatever, but you have to stick under his umbrella. I said, I want to do something on my own. I want to be the drive of my career, not to have to follow somebody else. In fact, when I finished my plastic surgery residency, my boss, which is a great surgeon, and we're still in contact, amazing guy, but he offered me a place in the hospital, in the public service hospital in Verona. And I said, no, I want to do my own things. If I stay here, you just close my wings and I'm just being one of your, Muppets that you move in a nice way. Don't get me wrong, but I want to do something on my own. That's why my plastic surgery career started. And aesthetic, because then when you go solo, you do more aesthetic. Because for the reconstructive, you need the hospital. And I cannot see myself working in a hospital in this kind of environment anymore.
Interesting. It's a fascinating subject, you know. I want to talk to you about your business stuff in a second, but I want to try and explore this a bit more. Men having secret surgery. I don't think I've dug deep enough into the whole man thing. I don't even know if, I'm saying this to you and it's almost like, am I asking for me? And so I hope I'm not. Of course, there are men that are confident, men that will come to you and say, I need some Botox, I need some fillers, I'm happy, I'm proud of whatever, okay? I've never had anything, like ever anything. And everyone at work thinks I have. Like everyone at work thinks I have. And I swear on my children's life, I've never had anything. The thought of having something done and someone finding out about it just fills me, riddles me with shame, the thought of doing that. Now, I know that Alex here that works with me, he's had, more surgery than Joan Collins. But for me, it's a real issue. When men come to you that aren't proud and loud about it, okay, is there a percentage of men that come to you that are just like, or go into this whole surgery, cosmetic surgery place in a very fearful and intimidated way and don't want anyone to know about it?
Yeah, because women, they start at a young age to do little tricks and tricks, so Botox fillers, little things, etc. So they're used to see their changes. So what I think men are afraid of, to look at themselves in the mirror, don't recognize themselves. That's what they're afraid of. Because if a man has to come and do a liposuction, for example, it's not a big deal. They don't see a change in their daily life. Because if I have liposuction, tomorrow I go out, you don't recognize me that I've done liposuction because I'm swollen. So that you can say after a few weeks, I said, oh, you lost weight. That's it. But if you do something on your face, that the face is the main issue, of course people said, oh, have you done something? Or have you, and it's not a secret, I've done my nose, for example, 3 years ago. And it was something that was always bothered me for all my life. And I said, I want to fix it. And I did it. I had complication because, of course, when a surgeon does a surgery on a colleague, there is always a complication happening. So I had major complications coming out. So the result is not even perfect, but I'm very happy because exactly what I want is something subtle. People do not notice. And people, when I said, oh, but you didn't need it. I said, you think you didn't need it. For me, every time I was looking myself in the mirror, for me, it was a big deal. And when I show the difference, the before and after picture of myself, and when I said, oh, yes, now I understand. It looked much better now. And it's so subtle that people really do not understand what has been done. But it's that's the secret. That's what I started saying. I want something natural, something people will not recognize on my patient. And you said, oh, every surgeon says that. But some surgeon has a heavy hand in a certain way. Maybe they're great surgeons. They're not saying that they're bad, but their results are very obvious, out in your face.
And these men really don't want anyone to know stuff because they're
no.
ashamed.
Yes.
Should they be ashamed? Should they be ashamed?
No, absolutely. Why? If you fix something for yourself, and I always tell the patient, you have to do this for yourself. Don't come for your boyfriend, your husband, your kids, your social status that everybody in your circle has done, the nose or the boobs, and you have to do that. No. You want to do that? Do it. You don't want to do it? Don't do it. That's the goal. That's the thing that I want people to walk in my office with the confidence that they have this defect. And sometimes really people come into my office and of course, the moment they enter, I already scan them and I say, okay, she wants this and that, maybe because I've experienced and I know. Some patients surprised me and said, maybe they have a huge nose like that. I said, I want to have my ear done. And their ear perfect. Let's say. And I said, but this is what, and I do the ears.
What did you just give him a mirror?
I cannot do like I want to. I cannot do like that.
Yeah.
But at the end, you do their ears because if there is an indication, of course, I do that, and they are the most happy person you ever seen. And I said, but why? And I said, my nose is like that. Is my family status? I don't know. And everybody.
You made me think about something just then. About symmetry.
Oh, yeah.
Is there such a thing as a perfect face? Is there such a thing as the perfect distance between the two eyes and this? Because I've seen like online and stuff like these dotted lines that go around. Is there such a thing?
So there is a lot of history about that. We can talk for 3 hours. Leonardo da Vinci created the golden ratio.
Okay.
With the golden ratio that goes also in the face. The beautiful face has a golden ratio. And I've seen recently on Instagram this guy, which is a very good artist, okay, and he's taking the faces of famous actors, actresses, etc., and put this mask, which is our lonely lines, how the perfect face should be. And he changes on the iPad with the pen the shape of the face. So leave the eyebrows, remove the eyebrows, remove the eyelids, nose smaller, bigger, whatever. And he creates, and you see these people and you think, are they really more attractive or less attractive? And they did a very interesting study a few years ago. They took Angelina Jolie and Brad Pitt, which we all know they are the two most renowned, handsome people in the world, in the female group and the male group. They took their faces, a photo, they cut the photo in half, and they put one half on the other side, so make them symmetric. I saw those pictures. They're less attractive than they are now with their asymmetries. So I always tell my patients, symmetry is not beauty. Nature is not symmetric. Nature is perfect, but with its asymmetries, with its defect. If you look really, if you think the most beautiful woman you have seen in your life, actress, whatever, look at her. Is she really perfect, symmetrical? Maybe not. But she has something. So the external beauty can be enhanced, but it's not the only thing. There is something else that goes around the beauty. And symmetry is not one of that. Absolutely. This is one of very strong statement that I make today. And I work with breasts, so I work with symmetry.
Yeah, I guess, yeah. Okay, there's more questions I want to ask, and some of them I don't feel I should ask, but 1,500 surgeries. You've been in the UAE for a long time now.
12 years. Yeah.
You're one of the leading plastic surgeons here in this country, and you've got great respect from people because of the great work that you've done, which is fantastic. We assume plastic surgeons will make a pretty good living and do very well for themselves, and I would just assume that you're in the same zone as that. I mean, why would you study for 11 years unless you're going to start coining it at some point? Can we talk about the business of being a plastic surgeon?
Yeah, definitely.
I want to understand. I can understand why you'd study for 11 years to do it and you're interested in the subject. Fine. Let's park that. Making money. When you open a clinic, there's obviously a large investment involved in opening a clinic. There's licenses and all that kind of stuff. What kind of profit margins do businesses like yours work on?
Very difficult to answer this question because it depends if you do something on your own. So you are the only surgeon, you have your nurse, your secretary, and that's it. Or you do a big clinic like many of other colleagues have here, where they have dermatologists, GP aesthetics, dentistry, laser therapists, etc. So this can change and shift, of course, the dynamic. At the moment, I don't have my own clinic. So I have a health consultancy company, which basically provide my service, and I have a junior plastic surgeon working with me that we go in the clinic and then we have a percentage that we leave to the clinic after.
Okay, so you use their facilities.
Exactly.
But you have to get your own clients.
Exactly. Basically, yes.
Yeah? So you bring the clients in, they want a fee for every operation or whatever procedure you do.
Exactly. And
and that's a fixed percentage that's paid to them every month or every year or whatever. Okay, fine. And the rest is yours.
Yes.
So then business development must be pretty important for you.
The base of my success was I studied a lot marketing, which unfortunately doctors, when we study medicine, nobody teaches anything about this.
Good. Stay focused on the medicine.
No, but in a certain part, especially now that I see how the healthcare landscape is developing in Dubai, a lot of clinic, if you don't have patient, they don't hire you. A lot of doctors, they've been hired with a promise of high salary, and then they said, oh, you didn't bring any patients. So the salary from, 50,000 a month goes to 10,000 a month.
Yeah, but that's right. They're a business too.
Yes, but the doctors have not been taught to do that. That's how it's changing.
Okay, but the doctors have not been taught, or the doctors didn't take it upon themselves to learn. They're not victims here.
Yes, absolutely.
Okay? I decided not to learn about marketing.
Kind of.
End of story. Okay?
I have some colleagues that said, are you busy?
I decided to learn about marketing, is what you did.
Yeah.
Okay. They're not victims. I'm not having them placed as victims on this show. Okay. If you chose not to learn marketing as a doctor, then that was a choice you made.
Yeah.
Okay. And that's going to cost you money. Okay.
Lots of money.
But let's be honest, you're dealing with specialists. I call them artists to some degree. In business, you have artists, you have operators.
Yeah.
And so you have these different functions, and some people just need to be, they don't want to go into management structures and walk up the corporate ladder. They just want to do their magic, and whether that magic is breast augmentation, whether it's designing houses,
absolutely,
whatever it may be. And so why should they learn about those things? They should bring all of those other things around them so that they can continue being an artist. Yeah. So if a plastic surgeon, because there's lots of people moving here. If a plastic surgeon turns up here in Dubai, he's going to have clients from the country that he came from that maybe he flies backwards and forwards and operates on, but he's got to find a new client base here. So what advice would you give to a surgeon to go out and get a new client base here in the UAE?
First of all, you need to create your own brand. Create a brand identity that is yours, is unique. Because you know that Dubai, UAE in general, has the higher concentration of plastic surgery in the world?
No.
Yes. Brazil has this. I need to update these statistics like 3-4 years ago, but Brazil has 28 plastic surgeons per million inhabitants. Brazil, which is the house of plastic surgery. Everybody knows that Brazil is the history of plastic surgery. Dubai, UAE again, sorry, it's 56, exactly the double.
There's twice as many plastic surgeons per million.
Concentration, yes.
You're joking?
No.
And it's the highest in the world?
Yeah.
Wow.
Because, UAE is a very concentrated country. Okay, Dubai, Abu Dhabi, etc. They're very concentrated. So there is the amount of spaces available for plastic surgery is that, and the percentage is that high.
But then does that mean it's really hard to find clients?
It's very difficult.
And is it
If I came 12 years ago, I had 12 years to slowly, steady, with different mistakes, because I did a lot of ups and downs in my career, but slowly understand what was working and the message, and people now know what they're coming to me for. They know what kind of results I can deliver. And if they want the overdone look, they want the total body makeup to transform, complete the body, I'm not their surgeon. And they already, before I was seeing all these patients, I was saying, no, I don't do that. Now, they don't even come to me. They're very minimal. That one said, I know you don't do these things, but I trust you. I've seen your results. So even if you cannot do exactly what I want, but I know you give me something which is good. But the rest of the patients are coming to me because they know what I'm delivering. And this was thanks to my marketing, the messages that I'm delivering for 12 years, saying that this is what I do. And I don't want to, take full of people saying, I promise one thing and I deliver something else. This is what I do. And people love this transparency. Because we were discussing, before also how many clinics they grab you and they try to sell you everything.
Hold on a minute. If I knew there was 56, yeah. 56 surgeons per 1 million of capita here, which is double the highest place in the world, which is Brazil, I would be thinking long and hard about whether I would be wanting to come to Dubai now if there's that much competition.
Exactly. I have a lot of colleagues from Italy, of course. I'm Italian, so a lot of specialists, but not only plastic surgery, mainly, they call me and said, I want to come there. Because Dubai is a dream, is El Dorado. Everybody comes here, thinks that they will become billionaire in one day. It was maybe back in the days when I moved here and I think I made the best decision in my life to move here at that time. Because I told you before, I was the third plastic surgeon moving here. Third Italian plastic surgeon. And I had all the time to, again, build up my success as it is today. But if you come now, you need to really, struggle to find your spot. Or you're lucky to find a very successful clinic. And maybe you are super well known because you do the best, noses in the world. Okay. So you come here with specific focus and the clinic you're working for is very good in marketing and they bring you to the apex of the success. That's a lucky way to do it, but you need to have particular skill. If you are, I'm saying, like I consider myself an average plastic surgeon in the sense that the result that I can deliver, a lot of my colleagues can deliver the same. They're as good as me. I'm not the best in the world for nothing. But if you are, again, the standard plastic surgeon, it's very difficult now. How can people recognize that you are good? And you need to invest in marketing. And now there are a lot of strategies for marketing, but your brand, your message, how you present to people is the way that people start trusting you.
And are you, just to correct me, have you established a business now where you're helping people do exactly that?
I'm in the process too.
Tell me more about that. Is that come from a business development opportunity because you've got an entrepreneurial brain, or is that because you've seen people in a bit of pain, not knowing what to do?
No, both of the things. So I'm part of the Canadian Board of Aesthetic Medicine, which is a big association that delivers training in aesthetic medicine in Canada, but they also open a facility here. And I work with them since 6 years. I'm their teacher, the trainer. I'm going in 2 weeks to Toronto for their conference to do live demonstration and teaching. And they asked me to do for the JCC region a webinar about how to build the aesthetic business in the UAE. I had 60 attendees on the webinar. And I think 40 of them contacted me after the webinar, said, can you give me some advice on this? Can you give me some advice that I don't know? How did you know about that? How can you develop the website in this way? How can you do the social media? I said, there is the need and there is the hunger to learn more about this. And I said, I can use my success story to deliver some messages and to create something which can help other people. So it's a big project. Mm-hmm. I just started to put it all together.
Okay, so it's been around for a long time. It's evolved. Okay, you see different stuff going on when people are getting, in all kinds of cosmetic stuff. It's like people are getting veneers that are thinner and thinner and thinner. I keep seeing these women walking around with like these pegs for teeth when they have these veneers put on, and we'll be in a restaurant and one of them will bite an apple or something and a veneer will fall off, and it makes me laugh a lot when I see that kind of stuff. But it's moving more and more and more. I see when I was a kid, braces were these wires that would go across your teeth. Now this Invisalign and stuff like that, and these things people put on their teeth.
Amazing invention. Amazing.
All this stuff. This is just evolution and technology. There's a friend of mine whose nephew broke his neck after he scored a goal playing football when he did a somersault, and he had to have this metalwork put into the top of his spine, and he invested in the company because he see that it was the future of solving this particular problem. So this stuff comes along and it keeps evolving. Breast augmentation, liposuction. What you've told me today about liposuction makes my skin crawl, and what we spoke about earlier with men getting implants in their calves.
Also, yeah.
I don't even know where to go with that. I really don't. Would I have my eyelids done? No. Do I need my eyelids done? Maybe. But I'm a bloke. I'm going to get old, and I'm going to be like a fine wine. So let's just talk about how. Give me an example of a surgery that's gone from an old-fashioned method, something that I would know over the last 20 years, that's now turned into there's a new, faster, quicker, pain-free way of doing stuff. Give me an example.
First of all, let's start generically saying that all the surgery is going towards the direction. Pain-free, fast recovery. So all the kind of procedure that we know, they're trying to achieve this goal. Again, I said I'm a breast surgeon, so the main thing that I'm an advocate for since the past year is Mia Femtech, which is the minimally invasive breast enhancement.
So what is it called again?
Mia Femtech.
Mia Femtech.
So Mia stands for minimally invasive augmentation, and Femtech is the technology around feminine, around the world of women. And it's a breast enhancement done with an implant in 15 minutes under local anesthesia through the armpit. There is no cut on your breast. The tissue of the breast is totally preserved.
Slowly. Make sure that, because there'll be lots of guys driving home in their car right now going, what the F, So just explain it slowly.
So it's a breast enhancement where through a 2 centimeter incision from the armpit,
right,
I'm able to insert a small implant in the breast above the muscle, preserving completely the breast tissue, and can be
no
done.
scars?
No scars on the breast, and the patient can walk out, because it's done under local anesthesia. They can walk out 20 minutes after the end of the procedure, go home, and continue their own life. Somebody named it the lunch break boobs, because it's kind of this thing.
And that's happening now?
Yes.
You're doing that?
I am one of the first plastic surgeons in the UAE who started this technology. They presented me like 4 or 5 years ago when it was still studying how to make it perfect. It was not launched yet in the world. And when I saw it, I said, I want this. This is the revolution. Since it started, in 1 year, I did more than 80 procedures right now. And I can tell you that it's phenomenal. It's phenomenal.
How big's the cut?
2 centimeters.
Like 3 stitches?
Yeah.
3 stitches, they come in, and I know we just gave it a real funny name then, but so they come into your clinic at 9 o'clock in the morning and they're home by lunchtime?
Yes.
Really?
Yeah.
Just like that?
Just like that. And if you...
What is good and bad about that? Give me the good, okay, and the bad. I want to know the bad too.
So the good is that this technology fulfilled the desire of a huge group of women. So the company that invented this made a research around the world. They did a market research about 17,000 women who didn't have their breasts done. Okay, 70% of them were not happy with their breast, and they were using compensatory behaviors, padded bra, push-up bra, whatever. And among these 70%, more than a half, I don't remember the exact quantity, I think it was 60% of them, they were not considering a breast augmentation because of general anesthesia, because of the pain, because of the long recovery, and because of the social judgment. They didn't want to be judged by other women. So they said, okay, let's remove the general anesthesia, let's do it local. Let's remove the long recovery, fast recovery. Let's remove the social, so something very subtle, and they did all these things, and they created this perfect technology to deliver this result. So this is the good thing. They fulfill the women desired, and the market also in the patient pool that you are fishing your patient from, it's huge, bigger than the breast augmentation one. Because they are, let's say, normal, strange to use this word normal, but like people will never think that they will do something like that. And I had some testimonial that came on my podcast, on my social media, saying that I never thought I would have done anything for my breast. And yet I'm here showing my result and saying that I'm super happy. So these are all the good things. The bad things is that it creates the desire in women that, unfortunately, they are not suitable for this technique, because this technique is not for everybody. You need to have specific indications. That I'm not bothering you with. That is a longer list of indications, but some people come in and say, oh, I'm excited, I want to do that, and then maybe their boobs touch their knees, and I said, this is not a technique for you. It's just for small breast. We need to have certain specifics that we need to respect. So creates an hype, and sometimes you have to destroy this hype for the women. That's the good and the bad things. But even for the, facelifting, when now they're doing minimal invasive facelifting, I said, you think, oh, that's perfect, that's good. But then the patient comes and, you need the full facelifting. So the old techniques are still in place.
I don't know why every time you talk about something, I want to touch the part of my body where I don't know why. Have you noticed that?
Yeah, I'm not doing your breast. I'm telling you, I'm not doing your breast.
Everyone that's listening to this, not watching this episode, and you're listening in the car, I'm literally, every time he said something, I touch a certain part of my body.
Yeah, but everybody looks at this, oh, really, I can do that? And then they look at it.
Thank you so much for coming to join us today. It's been really, really good talking to you. Thank you just for being honest and open and allowing me to ask my stupid, ridiculous questions to you.
No stupid question, plastic surgery. I receive a lot. I told you before, a patient coming with the iPad with like 30 questions. So I listen to all of them. It's my passion. So at the end of the day, I'm happy to talk about it. When I talk about it, my eyes, glows, and that's my life, and I'm so happy to be here, and thank you so much for the invitation.
Thank you. And lastly, before you finish, you have a podcast.
Yes.
Okay. I think people might want to tune into your podcast too. What is it called?
It's called Beauty Talks by Dr. Matteo Vigo.
Okay. And so on all the standard podcasting channels.
Yes.
So if you're listening right now, watching, go and give Dr. Matteo a follow and click and subscribe. He's on YouTube as well.
Yeah, YouTube,
okay,
Spotify, everywhere.
And if you want to learn more about plastic surgery, I think it's important that you consider that. Dr. Matteo, thank you for your time.
Thank you so much.
This episode is proudly sponsored by Allsop & Allsop, Dubai's leading and largest real estate brokerage. Now, with over 16 years in business, Allsop & Allsop have transformed the real estate experience for thousands of buyers, sellers, landlords, and tenants. By leveraging cutting-edge technology and data-driven insights, they are the consistent driving force behind the growth of Dubai's real estate sector. Their unmatched expertise and industry knowledge empower clients to navigate the market with confidence, no matter what their needs. Committed to finding your perfect home, they, without exception, ensure your real estate experience is as seamless as the property itself. Whatever your property needs, keep moving with Allsop & Allsop, the trusted choice in Dubai real estate.